we introduced the term zombies for ideas that are intellectually dead in defiance of all of the evidence, which can't kill them. They won't stay buried. And a zombie has two features. One, it is that it's an idea that is superficially plausible. It just happens to be wrong. And the second is that it serves somebody's interests. All healthcare systems have within them three major axes of conflict. Doesn't matter whose system or, it's nothing peculiar to Canada. They seem to be particularly acute in Canada at the moment, partly for reasons that Dr. McGregor has mentioned, partly because we have the misfortune of living next to the world's most inefficient and inequitable healthcare system. But whatever the reasons, we seem to be engaged in these debates a bit more acutely, but they go on in all other countries as well. And those axes of conflict are, who, as it says on the slide, who pays, who gets, and who gets paid. Who pays? Answer is all of us. We don't get foreign aid for our healthcare system, unlike some smaller countries. But within that system, who is it that pays more and who pays less? How will the burden be distributed? Fertile ground for conflict. Second, who gets? What determines priority for access to healthcare? Again, separate from who pays, but lots of room for conflict. And third, who gets paid? Remember that every dollar of expenditure in a healthcare system is a dollar of somebody's income. So whenever you start talking about this program which I am going to introduce will save money somewhere else in the system, you should be asked, whose income do you plan to zap? Who's going to lose as a result of the cuts to costs that will emerge as a result of your favorite program? The private agenda, this comes in before the numbers, the privatization agenda is about transferring costs from the healthy and wealthy to the unhealthy and unwealthy. Anything you do that increases the proportion of private financing is going to have this effect. That's different from private delivery, which need not have that same effect. As Dr. McGregor pointed out, most physicians in Canada are private, but their bills are paid by the public. So shifting the funding mix is about transferring, and that's why the issue never goes away. These are fundamentally real conflicts of economic interest. And because they are fundamental and real, they can't be suppressed, they can't be solved, they can't be wished away. They're going to come back and back and back. And it really comes down to what kind of system do we really want? It comes down to the values, as the Romano and Kirby commissions emphasized. The improving the relative access for the wealthy. Again, most privatization proposals boil down to saying, do the wealthy and unhealthy get a better access than the unhealthy and unwealthy? And that, again, is part of what privatization is about. Increasing the incomes of providers. In mixed public-private systems, providers, UK is a good example, operate on both sides of the street, so they're able to do the wallet biopsy on their wealthier patients and say, well, the National Health Service is underfunded and it'll be months before you can get your surgery, unless, of course, you're willing to see me privately, in which case we can do it tomorrow. Pull out your wallet and let's go. And that is, in fact, how it works, and that is how you would expect it to work. That's what economics is about. And then finally, adding new income claimants, and this is where private insurers, administrators, investors, stockholders, a huge array that we haven't seen too much of outside the United States, but they know where the rest of the world is, and they're very interested in it. Okay, next please. This is, again, just reiterating that identity that I gave you. This is not an economic theory. This is an accounting identity. It can't be wrong unless you make an arithmetic error. So you have to just keep in mind, as I mentioned at the beginning, that whenever you talk about total expenditures in a system, you are also talking about total revenues, total incomes, and so on. And so the notion that, for example, the question on the list, do private providers lead to lower costs? Like hell they do. The costs of the system are their revenues. The drug industry is not interested in lowering the costs of the drugs. That's their sales. So it's just fuzzy accounting to imagine that privatizing delivery in and of itself will lead to lower costs. Now, if you had a way of inducing intense competition among private providers to force their prices down, which is what markets are supposed to do and don't do in healthcare, then indeed, perhaps private competitive delivery might lead to that. And in fact, the New Zealanders have been very successful in forcing competition among pharmaceutical companies and dramatically reducing the rate of growth of their pharmaceutical costs. But you have to structure the market. It doesn't happen automatically. The blue line, the Americans, pushing 16%, projected by 2015 to reach 20% of their GDP, roughly double what it is now. The GDP is the kind of sum of all the income in the country. It's all the economic resources in any country. And basically the Americans are on track within 10 years to be not only spending more than everybody else per capita, but to be spending double the share of their national income. You want to see a system that's out of control? There's a system out of control. Once again, I'm showing what would have happened without the tax cuts as against what did happen. And what you can see is that provincial revenue as a share of GDP is actually now basically back where it was in the 80s. It really hasn't moved very much. It started to go up and would have gone up a lot more if it hadn't been for the tax cuts. But it's, it's noodling along. It's not doing anything very exciting. There's no crisis story there. What there is, and this is where the green lines, the upper purple line become important. What there is a story that says as the provincial income in total, domestic product, rises, revenues for the government tend to rise even faster. You have to cut your taxes in order to stop it from rising even faster. So when the Premier says, we don't own the GDP, what's that got to do with us? The answer is, no, you don't. But in fact, as GDP rises, your revenues rise even faster. So you do find that this government, between 2001 and 2005, their revenues actually went up faster than provincial income, okay? They did the tax cuts right at the beginning of that period, but it's what you call the income elasticity of provincial revenue. It's greater than 1, means it goes up faster than GDP. So the GDP comparison is perfectly relevant. The bottom line is federal transfers, and this is what Dr. McGregor was saying. There was that big cut in federal transfers in the mid-90s, hasn't been entirely restored. It's come back up a bit, but it's still by no means fully restored. So the top line is provincial all-source revenues. The bottom line is provincial own-source revenues. That's what's being raised within BC by the BC government. Then you add on what the federal government is providing, and you get the top lines there. Okay? Now, let's take that one stage further. Now we have provincial government expenditures on Medicare and on other health programs as a share of total revenue. In other words, is it chewing up a larger and larger share of our total revenue? And the answer is actually, yeah, total health is rising somewhat. You can see that top orange line. It wouldn't be if they hadn't cut the taxes. The reason why it's taking up more of revenue is because they reduced the revenue. But if they'd left the revenue alone, we would have traveled along the green line, and it would now be relatively low in historical terms. But again, nothing terribly exciting. If you look at Medicare alone, you get the pink line, and indeed, Medicare has gone up a bit, now going down a bit, and in historical terms, it's not doing anything exciting at all. And if they hadn't cut taxes, bottom blue line, we'd be down now as a lower share of provincial revenue spent on Medicare than at any time in the last 25 years. So this underlines both the importance of the tax cuts and the fact that even with the tax cuts, Medicare is not running away with anything. So where does the crisis come from? Okay, now let's make a crisis. Orange line. Okay, got it? You got an orange line? Okay, orange line, my golly, look at how health spending is rising as a share of total spending until the last year, of course. And it is, it has been. This is quite true. That is not a lie. It's deceptive, but it's not a lie. The rest of public spending has been coming down. How do you get that ratio to rise? Well, you can either have it rise because health spending is running out of control, which it's not, or you can have the ratio rise because other spending is being slashed. Is that what's going on? Yes, it is. Okay? That comes straight out of the federal fiscal tables. So what's been going on is that provincial governments, all of them, not just BC, have been cutting their non-health spending in order to bring their overall budgets back into line. Remember that first provincial chart I showed you? That process has now been completed. And lo and behold, notice that little orange line has stopped rising in the last year. So that if it was necessary, and it probably was, to try to bring the budgets back to fiscal health, they did it by chopping non-health spending. They didn't do it by chopping health spending, but health spending wasn't running away with anything, and so that's how you got that ratio that made it look as if it was. But that process is over. They're now into
surpluses, and they're now into tax cuts. So that's the history of the 1990s. That's not the history of this decade, much less the next decade. Unless, of course, they go on continuing tax cuts, in which case, yes, you can make this happen. Now, these are national averages, but the BC situation is very much like this. The last year before this government was elected, last fiscal year, 2000 to 2001, ending in end of March 2001, surplus in the BC accounts of $1.5 billion. The first year of this government, deficit of $2.5 billion. Why? Because they cut the taxes. However, they promised that they would restore balance during the life of their first administration, and they did. They did it in spades. Big surpluses coming down the pipe now. So they kept their promise. Fair enough. How did they do it? Answer: they cut spending. Spending in BC between 2001 and 2005, spending on public government spending on all things, rose by about 6.5%. That's not enough to keep up with population growth and inflation. So in real terms, per capita, they actually cut public spending. They couldn't cut health spending, so they held it back compared to what people wanted, cut other things. Their revenues went up, if you include the federal transfers, their revenues went up about 28% over that 4-year period. So in 4 years, revenues up 28%, expenditures up 6.5%. Well, that's a pretty good way of producing a surplus, and they did produce a surplus. But my point is, they did it by radical cuts in public spending, necessitated, if you want a surplus, by the previous cuts in taxes. So it has been a transfer to taxpayers, and primarily to upper income taxpayers, paid for by cuts in public spending. And to pretend that this is going to go on into, in 2017 or 2020 or 2000 and whatever, this is, I think, not a good way to start a conversation. Canada is actually, on this count, 13th in the world on private insurance. We don't think of ourselves that way, but when you actually add up the total numbers, we actually raise a relatively high proportion of our healthcare spending through private insurance. It's just that we don't do it for hospitals and medical care, which means we don't give privileged access to the wealthy among us, and that's a very severe fault in our system, which the privatizers look forward to correcting. Thank you.